I can mute my.
No need. Now that we are live on both platforms, it's fine. It was because before we were
Should we use JE zone?
No, it's fine. Don't worry. Just continue. It's okay.
But there's an echo.
Yeah, it's going to echo a little bit.
Should we mute? I don't even know how I'm going to do this.
If you mute, we won't hear you. Okay, let's just try and see how it goes. Okay, good evening, Instagram. Welcome to ATP Live and welcome on Facebook as well. I'm Gbemisola Boyede. I'm a pediatrician, and today is a special ATP Live. As you can see, that I'm not alone today. Okay, I need to remove this one. Okay, yes. So today I have very special guests all the way from Canada with me in the room because we are celebrating 2 special days. Actually, yesterday was World Oral Health Day. And it's a day where we normally commemorate our oral health and hygiene. And have with me a pediatric dentist and oral health promoter, and they are going to be telling us everything we need to know about our oral health. And of course, you're also going to be able to ask your questions. So welcome to them. And also today is actually World Down Syndrome Day. So it's a day where we talk about Down syndrome and what is the significance? What is this genetic condition? So again, if you have questions on Down syndrome, we're going to be addressing them. So welcome everybody. This program is brought to you by Ask the Paediatrician Foundation. Please share the video. Okay, we're trying to go live. I think it's going to be echoing a lot. So I don't know whether we should mute the Instagram on your side, Dr. Buki.
Okay.
Yeah. Okay, yeah. For now, when you're talking, we can unmute. All right. So please let's share the videos, invite your friends and family. Let everybody that should be here because it's going to be a power-packed session. So today I'm not going to answer any question that is not oral health or Down syndrome related. So please, it's a ATP Live Special. So try and reserve your questions only to questions on oral health and Down syndrome. So we're going to quickly just share the video in the next 5 minutes, and then Dr. Buki will do a presentation with lots of support from Jay, our oral health promoter. But before we start that, I'm just going to quickly make sure we share all the videos on all our platforms to make sure everybody can see and can hear. Just give us 5 minutes to do all that. So please share the videos and invite friends and family to be here. Okay, I also need to go live on my. I've forgotten that. Okay. Okay, so I'm just sharing the videos, making sure everybody can see it, especially on our groups. This is a challenge of going live at the same time on Instagram. Okay, so still sharing. Just give me a few more minutes to do that. Dr. Buki, can you just mute? I don't know if because of the echoing. Okay, and then I'm almost done sharing. I just need to make sure I pin them to the right, to the featured end of the groups so that everybody can see it. So welcome everybody. You're watching ATP Live. And today is going to be a power-packed one. Okay, we're almost there. Okay. I think somebody has helped me to do it on ATP Family. Okay. Okay, and I'm looking for it on my ATP group proper. I'm always looking for it. Okay, just 1 more minute. I'll be there.
Yeah, exactly. That's
Okay. So for any of our moderators, if you can see my video on the ATP group proper, can you just pin it for me? Because I can't even see it myself. I don't know where it is. Okay, yeah, I've seen it now. Oh, lovely. Okay, good. So I've finished sharing on all the platforms. So we're ready to go for Dr. Buki to do a presentation. So yesterday, as I was saying, is World Oral Health Day. And so because of that, we have Dr. Buki here. And she's going to be sharing with us everything we need to know about World Oral Health Day. So welcome, Dr. Olatosi and Jay. Welcome.
Thank you.
Okay.
Is there an echo?
Yeah, the echo is much. Maybe I should mute myself.
Okay, go ahead now.
Thank you, Dr. Gbemi Boyede. And happy World Oral Health Day to you all members of Ask the Pediatricians. I wish you all a happy Oral Health Day 2022. I think we still have an echo.
Yeah. Do you mind muting your mic on your Instagram?
Okay, that has been muted. I have muted that.
Okay, but I don't think it's muted because I can see here your echo. Because if it is muted, people can hear you from my. They will see you, but they will hear you from my laptop.
You're muted.
So you need to turn off the mic.
Okay.
You need to turn off the mic for your Instagram, but let the camera just be on so people can hear you from the laptop.
Okay, is it better now?
Yes, I think it's better.
Okay. Still an echo. I don't know where it's coming from.
Okay, I'm not sure myself now. Okay.
Good, thank you.
I have a feeling it's from the Instagram.
But I'm on Instagram. I'm sure.
Okay. Something is echoing wrongly. Okay. You know what?
Okay. Is it okay now?
I think so.
Yeah, yes. I think so too.
Yeah, it's okay now. Good.
Okay.
Thank you.
All right.
I can't see your slide. I'm trying to hide your slide and it's okay. Yes, okay. I've seen what I'm supposed to use for the slide. Lovely. Okay, no problem. But you can still do your presentation first. When you're ready for the slide, I'll use the one showing the slides.
Okay.
Instagram people, you won't be able to see the slides, but I hope you can hear Dr. Buki live and direct, so that's fine.
Okay.
Just let me know if you have Instagram. Let me know if you have any question or anything. Just let me know.
Okay. So can we go ahead now? Okay. Thank you very much. Thank you, Dr. Gbemi Boyede, for this opportunity. I'm always happy to be here. Last year, we also had this live presentation, and this year is another one. Happy World Oral Health Day. And the theme is Be Proud of Your Mouth. Are you proud of your mouth? With me here today, I have Jehi, who is an oral health promoter. And she's going to also be answering some of the questions that we may have today. And so we're going to start again this year by saying that every child should have a good smile. And how can we do that? I'm going to be sharing some of my slides. I always say that good oral health starts from when a mother is pregnant. That is when you should start thinking of your child's oral health. And the kind of oral health, good oral health that your child has depends on the mom. So if you're a mother, you should start thinking about how you picture how you want your child's mouth to be. And so while pregnant, it starts with when you're pregnant, having good oral health. And I want to say that tooth decay is preventable. It is one of the most common chronic childhood diseases. It's even more prevalent than asthma. All of us talk about asthma, but tooth decay is even, more prevalent than asthma, and it can be prevented. So one way in which we can do this is when you're pregnant as a mother, you need to take in the right nutrition. And I will say that here, vitamins, right? The right vitamins, vitamin D, calcium, taking of milk is very important because while you're pregnant, the teeth are forming. The teeth starts to form like around 18 weeks during pregnancy. And it's important that what you take in can help the teeth with forming. Sometimes when the teeth are forming and you don't take the right vitamins, it can make the teeth to be malformed or deformed. And that's where some children, when they are bringing out their teeth, the teeth look somehow. I've seen some of the pictures posted on ATP where the mothers ask and say, oh, they don't know why their baby's teeth is like that. Some of it has occurred during pregnancy and when the teeth are forming. So I want to say that it is safe to come to the dental clinic when you're pregnant. The first thing is that when you're pregnant, you have to have good oral hygiene. Make sure that you are brushing your teeth twice daily, in the morning and at night. And if you have any tooth decay, that is a good time for you to go and to visit the dentist and make sure that those decay is being managed by your dentist. Because when you have your baby, children's mouth do not come with bacteria. It is the mothers that transfer the bacteria from their own mouth by sharing utensils. Some of you, when you have your baby, you chew the food and you share with your child, or you use the spoon that you have put in your mouth, and you also use it to feed your baby. That way you are transferring the bacteria in your mouth to that of your child. So some of the problems that occur during pregnancy is brushing. Some people have nausea and vomiting, and they find it difficult to brush when you are pregnant. So if you are pregnant, one of the ways in which you can do that is that if you feel that you are nauseous in the morning, you can just use fluoride mouthwash to rinse your mouth. And when you feel less nauseous in the evening, you can brush your teeth normally. And anytime you vomit, the vomiters has some acidic it creates an acidic environment for the oral cavity, and then it softens the teeth. And so it's important that you rinse off the acid anytime that you vomit during pregnancy. And then after the vomiting, 30 minutes after, you can now brush your teeth, because by that time, immediately after the vomiting, the teeth has become softened, and you don't want to use your toothbrush to also wash away or the enamel. So it's better that you rinse off and then wait for 30 minutes before brushing. And then we also recommend soda. Soda can be a spoon of soda can be put in water, just to neutralize the acid, and then you use it to rinse your mouth. Please do not swallow it. If you have questions after regarding this, please note it down. But those are some of the tricks that can happen. So you cannot say that you will not brush because of vomiting and all that, because you do not want your oral health to become, to be affected while you are pregnant. You still want to maintain your good oral hygiene. And then we've said that it's safe for you to come to the dentist. A lot of people believe that, oh, it's not safe to come to see the dentist when they are pregnant. It's safe. You can come when you're pregnant, and we can give you your treatment as appropriate to this trimester that you are in. And so, talking about pregnant, after, of course, when your baby is born, what do you do? Immediately your child is born. When your child is born, a lot of mothers ask questions. They don't even, start oral hygiene practice. Oral hygiene practice should start immediately, like few days after your baby is born. As soon as you start breastfeeding, you can use a clean cloth to damped in water to wipe your child's mouth. Something like this that I'm holding on my screen here. I'm showing us, and it's also showing on the PowerPoint that I'm projecting. I don't know whether those on Instagram can see it, but this is what it is like.
We can see it. Can you just turn the camera down a little bit on the Instagram
down so that you can see?
Yes,
okay.
Exactly. A little.
Okay, this is much better. So you can use the clean cloth, okay, dedicated to your baby to wipe the baby's mouth after feeding your baby. And then immediately the child starts to have bring out the teeth. What you can do is to use this kind of finger brush to brush your child's tooth. You put toothpaste on it. I'm going to show you the picture of this, although those on Instagram may not be able to see the picture, but this is what you can use to clean your child's teeth. So don't wait until all the teeth have come out before you start to brush. You use this finger brush, and then you put toothpaste on it. A smear or the size of a grain of rice is what you can use. The size of a grain of rice. Just put it on the brush and use it to brush your child's tooth or teeth as soon as they erupt. And after that, once your child is about 3 to 6 years, you can now use the appropriate toothbrush. Jehi, can I have brush? Yeah, you can use a bigger brush, and you can use the size, a pea size. When we say pea size, it's like the size of the vegetable, the pea that we use. Yes, you can use that to brush for your child using the appropriate size. So do not look at the adverts that you see on TV where they put excess toothpaste, even, some of it even curving at the end. What you need is the proper technique. Make sure you are brushing for your child twice daily, in the morning and last thing at night. And that's being said, and the brush should be changed every 3 months, or when the bristles have worn out. So that's very important. And then make sure that your child visits the dentist on or before the first birthday, because most of the questions that come to us on Ask the Pediatricians, many children have not visited the dentist and they are like 2 years, 3 years. The right time for you to take your child, whether the child is having any issue or not, whether the child is having any dental problem or not, the right time to bring is within the first year, so that you can get the appropriate information before anything starts to happen. At that time, we give you the preventive oral health education that can guide you in preventing some of these oral problems that the children may come up with. So having said that, with the brushing, of course, when you're feeding your children, we recommend that breastfeeding is good. Even the pediatricians, Dr. Gbemi recommends breastfeeding. But we pediatric dentists too, we love you to breastfeed your child as much, as the length that you wish to. But don't forget that you need to clean your baby's mouth, okay? And breastfeeding after 12 months, especially when the children have brought out their teeth at night, can cause tooth decay. I know most of you will want to ask me more questions around that. It is because at night you cannot, if you are not able to wake up to clean your baby's mouth, when the milk is there left in the mouth at night, especially when the children already have teeth and you're still breastfeeding them at night, what happens, and when you're not able to clean the teeth, is that the milk is just left there, and it creates an environment for the bacteria in the mouth to feed on the milk and also feed on your child's teeth. And those are some of the things that cause tooth decay in children. Also, Jehi, thank you. Bottle feeding. When you bottle feed, giving your child a bottle, make sure that the bottle only consists of formula. Don't put juice or Bonvita, or even leave the bottle in the child's mouth to sleep. I know it's very easy to leave it and just allow the child to continue walking with the bottle throughout the day, but these are risks that that can cause tooth decay. Some parents will say they don't even know how it happened. These are some of the practices, feeding practices, that can cause tooth decay. Leaving bottle throughout the day is very convenient, but it's very dangerous. You leave the child, especially putting beverage or milk or Capri-Sun or some other sugar-nated drinks. Yes, you can help me with that. Yes, in the bottle and leaving it for the child to sleep is very dangerous. So we must not do that. So as the child continues to grow and they are able to now take snacks, we must limit sugar intake through the kind of snacks that they take, chocolates, cariogenic, we call it cariogenic diets, where we give our children. So if you are going to give them at all, because sometimes it's not practicable, the children go to school, they give them snacks, they give them all sorts, their cakes. You can limit it to meal times, because one of the problems that occurs is that the frequency of giving them this snack during the day is what actually contributes to the tooth decay, because the mouth does not have respite. I want chocolate to give to your child. I want Capri-Sun every now and then, no respite for the mouth. So there's what we call the pH of the mouth. When you keep taking acidic things, the pH drops, and it keeps the mouth in a constant environment, acidic environment, that will attack the teeth. But if you allow the mouth to rest, in between, when the children want something, snack, they want to chew on something, give them healthy snacks. We have banana, give them fruits. Let them eat, healthy snacks rather than giving them sugar snacks all the time. So that with their diets. You make sure that their diet is good. You give them fruits, you give them vegetables. And we've talked about them visiting the dentist within their first year of coming. Another thing is that we talk about transferring this bacteria that causes tooth decay. When children are born, they are not born with bacteria in their mouth. We are the ones that transfer it. You can transfer it to your child. Sometimes you use the spoon. You want to make sure that, this food is not too hot. Sometimes you put the spoon in your mouth to test the food before giving it to your child. You have to make sure that spoon you have used, you don't use it. You can drop it and then take another spoon to feed your child. So visiting the dentist is also very, very important. Make sure that within the first year, you have brought your child to see the dentist. And then teething, we are going to talk about teething. Teething is very important. When we talk about teething, there's so many things and myths and beliefs about teething. But for us dentists, we believe that teething is a physiologic process. It's normal when a child is bringing out teeth, maybe the baby teeth, or even exchanging teeth. There's usually some form of the child is warm but not fever. There's just slight increase in temperature but not fever. When your child begins to have fever, please take your child to see the pediatrician. That is no longer teething. When your child is having diarrhea and vomiting, that is no longer teething. We associate teething with loose stool, but not diarrhea and not vomiting. So if you're having any of that, please rush your child to see the pediatrician, or take your child also to the dentist. If your child, some people also believe that it is boil. When your child is having boil or conjunctivitis, redness of the eyes, is teething. Many things are associated with teething, but this is not teething. If your child is having any other symptom, but usually in teething, the child cries, the child is irritable, because the gums, sometimes they want to chew on things. Okay, what we recommend is that you give them teething rings, soft teething rings. They can have the teething rings, and you can give it to them to chew, but do not give them uh teething biscuits. I've heard people talking about teething biscuits. Those we even add to your child having tooth decay. Some even use beads, that the child should chew on the beads. Please, these are very dangerous. These beads can cut into pieces, and the child can swallow it or aspirate it or go the wrong way. Please do not use beads. What you can use is teething ring. And the child can cry and be irritable, but not diarrhea, not fever, not conjunctivitis, not redness of eyes, not vomiting or diarrhea. That is no longer teething. Okay, so that is about teething. We want to also talk about natal teeth. Sometimes when the baby is born, it's rare. Children can be born with teeth in their mouth. Please don't worry about it. It's good to just see your dentist. Don't try to handle it yourself. If you see such, and I've seen many pictures, Ask the Pediatricians, where they show picture of something that looks like a boil. We call it eruption cyst. The eruption cyst, it just has to do with when the teeth are coming out. I've seen a lot of pictures of it. Some parents call it boil or something like that. Please do not burst it. Do not use anything to rub on it. Just leave it. Usually it will resolve on its own. But if it is not, just take your child to see the dentist. Then I want to talk about trauma. There's so much to talk about today, about if your child falls down or gets injured or the tooth falls off. The first thing you can do is that if you can look for the tooth, try to stop the bleeding. How do you stop the bleeding? Just take a clean handkerchief, roll it, and let the child bite on it. That is first aid. You want to first of all stop the bleeding. After the bleeding has subsided, look for the tooth around. If you can find it, hold the tooth by the crown, and then get a cup of milk, liquid milk. First of all, rinse it under running tap. Don't scrub it. We don't touch it by the roots. Just put it in a cup of milk and bring your child and that tooth to the dentist. So the dentist can always put back the tooth, and then we splint it, and your child can have that tooth for a long time. So if you never knew this before, this is something that you can do. If you cannot find milk, just put it in a cup of water. But time is very important. Don't keep it to the next day. Come immediately to see your dentist with that cup of milk or water with the tooth in it. If it's a baby, we will decide whether it is a baby tooth or it is a permanent tooth, because usually it is the permanent that we can always put back. If the baby's tooth falls off, we don't put it back because we don't want any infection for the permanent tooth that will erupt afterwards. But if you are not sure whether it's the baby tooth or it is the permanent tooth, all you just do is that take the tooth, put it in a cup of milk, and bring your child to see the dentist. Many people don't know this, but today you know this. So you don't have, your child does not have to go, with loss of tooth if you can find the tooth. And if you keep it, preserve it well. That's very important. Preservation is very important as well. So now, if we have questions, maybe Jehi, do you have, maybe Jehi is here. She's an oral health promoter. She can also help answer some of our questions. So I hope by the end of this lecture, you can be proud of your child's mouth going forwards. You can be proud to show off your child's teeth to anybody. If you can follow these simple guidelines, then our children can have healthy smile and bright future. So thank you, Dr. Gbemi Boyede, for this opportunity. I hope that our mothers have learned one or two things, and I'm happy to answer questions. Thank
Thank
you.
you.
And he's also here to answer some of our questions. Thank you.
Yeah. Thank you so much, Dr. Boki and Cheyi. That's beautiful presentation, and I can see lots of loves and happy reactions from our Instagram audience. Thank you so much. And but I've not seen any question on Instagram, but there are lots of some questions already on our Facebook platform. So I'm just going to be throwing them to you, one after the other. So the first question I have here is from Bright Steve. And Bright is saying that what toothpaste is good for a baby of 8 months? What toothpaste is good for a baby of 8 months?
Jane, do you want me to go? You want me to
It's
answer?
8 months.
8 months.
Oh. So, we actually forgot to show you the picture of the how much toothpaste you can use.
Can you
The
hear?
yeah, the toothpaste with the fluoride is good for your baby, but then 8 months is very young, and then we only recommend, as Dr. Olatosi mentioned, a little right size of the very grain, as that I mean, no, very smear size, because the baby is unable to spit, and we don't want the baby swallow the fluoride, because too much fluoride would make a tummy ache. Yeah, the baby may feel tummy ache, and then we want to use the benefit of fluoride to prevent cavities. So please use with the fluoride toothpaste, but very little. And then if you're very uncomfortable using toothpaste with the fluoride, and then you can always use like a little bit of just so very little size, and then you can even use little gauze like a cloth, and then just clean with your baby's teeth, and then you can just remove excess of the fluoride if you're really worried about cleaning with the fluoride toothpaste with a very young baby. Yeah, and then after 3 years old, you can start using the pea size amount, and that's when the baby can develop the ability to start spitting. So yeah, that's why we recommend the specific size, and then the little bit of amount of swallowing toothpaste is okay. It's not harmful. So yeah, I hope that answers your question.
Yes, it does. Thank you so
Yeah,
much.
thank you, Jehi. Yes,
So,
exactly. So we just use no, we don't want to mention toothpaste now. I don't know if anybody is
they know,
sponsoring us.
they know
So
the
this is an
brands.
opportunity for any company that wants to sponsor Ask the Pediatricians. You can come in, but we know that any toothpaste that has fluoride, check, and it's for children. Don't use adult toothpaste because it contains much fluoride that is too much for the children. So children formulated toothpaste, look for it, they are available, and then you use the correct amount, age appropriate amount of toothpaste for your child. Okay.
Okay, thank you. They know the brands. Don't worry, Dr. Bouquet and Jay. All right. The next question is by. Okay, sorry. I think she asked her question twice. Why is this question that disappeared? Okay. Yeah, it is the right question. Okay, the same bright. Okay, that one I was confused. Okay, the same person, but this is the second question. So she's asking whether glycerine is good for cleaning the baby tongue. And I really want you to answer this question because last week, one of the mom came to my page and she made mention about using glycerine, and I was trying to tell her this is what Dr. Bouquet, pediatric scientists, have said about glycerine, that you guys don't want that. But she was really like, no, that's the right thing. So I want many mothers in Nigeria do this a lot. So I want, if I some do it from newborns, so I want them to hear from the horse's mouth. So over to you.
Thank you very much, Dr. Gbemi. And thank you for that question, because so many, even other non-dental health professionals preach the glycerine. But today I wanted to hear it from the experts, if I can put it that
Yes.
way, that what we use, according to the recommendation by the American Academy of Pediatric Dentistry, is that when your child does not have teeth, use a clean cloth damped in water and use it to wipe your child's mouth, and that is enough. Anything that cannot take off, then bring your child to the dentist. It may be that the child has some candida or some other things in the child's mouth, but water and damp cloth, it's just okay. Please do not use glycerine. We don't want any other reaction or your child swallowing glycerine, and that is why we recommend only water and clean cloth. I hope that is
I hope that
understood.
mother
That
that
is
was
what we
having me
recommend
is
as
listening.
pediatric dentists. Over the years, people, I don't know where, maybe our mothers maybe used it and all that different, but this is coming from the pediatric dentist and recommendation by the American Academy of Pediatric Dentistry. No glycerine, but water and clean cloth. And if you need to brush, we have talked about it. As soon as the tooth erupts, don't wait for all the teeth to come out. As soon as you have the first tooth, start brushing your child's teeth. Thank you.
Okay, good. The next question is quite a long one. Okay, but she says she saw like a flesh is coming out of the baby's, I guess, the mouth, and they've been to the dentist, but the flesh disappeared before they could see the dentist anyway. So is this something they should worry? I think something is coming out from the gum, like a small flesh, like a growth on the gum. And so they were worried about it. They've seen they were going to see the dentist, but then it suddenly disappeared. And so is this something they should still worry about? Do they still need to see the dentist? It's a 2-year-old child. I think, yeah, 2-year-old.
Okay. Thank you for your question. I saw the question. So when the teeth are coming out, we say erupting. They are coming out from the gum. So it's like it's breaking out from the gum, and there's some, breaking through the flesh. So sometimes you still have some of it hanging on the tooth, but normally it will just resolve on its own. So I don't think it's anything for you to worry about. And that's why you said before you could go back, it had already resolved. But it's a good thing that you went to the dentist, and I applaud you for that. Anything you don't know, don't try to manage it yourself. Go and see your pediatric dentist so that they can help you. So that's fine. It usually resolves on its own. But if it doesn't, then you go and see the dentist. All right.
Okay. Instagram family ask questions. So it's only Facebook people I'm seeing here. All right. The next question is about bad breath and mouth odor.
I saw some questions on Instagram. Dr.
Oh,
Gbemi, maybe later you can scroll up.
oh,
A
okay.
few people put some
Maybe I'm not
questions.
seeing it. Sometimes I struggle with this scrolling, but I'll come back to it. Okay, but this question by Patricia is Ugochukwu. She had a 4-year-old who is turning 5 soon, who has bad breath and odor. And I think it's a good question. It's one of the most frequently asked questions when parents always tell us that they are doing all the oral hygiene, everything you ask them to do, but children still have mouth odor. She has seen a dentist, they brush the teeth twice a day, they use mouthwash, and other children didn't have mouth odor apart from this one. So she's worried what could be the problem and what can she do?
Okay, so there's so many things that can cause bad breath. We call it halitosis, and some people call it mouth odor. So starting with if the child has a bad tooth and is hidden, you don't know, and food is packing in there, and it's hiding somewhere, it can bring about bad smell and bad odor. Not brushing the child's teeth regularly, like twice daily, leaves bacteria in the mouth that will produce bad odor. Then there are some other systemic conditions that can, cause that bad odor to occur. So if you are having such, you have seen the dentist, you are sure that there's no plaque, you are sure that there's no tooth decay, then it may be worth also seeing a pediatrician as well, because there are some intestinal diseases that can, cause there to be bad odor, systemic conditions. So, which we can always talk about at a later date, but make sure that you're able to rule out poor oral hygiene, and we're able to rule out tooth decay or even ulcer. Make sure that there's no ulcer in the child's mouth that can be causing that bad smell. So that is it for halitosis in children.
Okay, thank you. So, in other words, if you see the dentists have sorted the dental path. You may actually
Yes.
want to see the pediatricians as well, because there are other
Yes.
conditions in the body that can cause bad breath apart from just mouth issues. I
Yes.
hope that is helpful, Patricia. Okay, the next question. Oh, Dr. Buki, the question on Instagram is not it's not an oral health question. So, like I told, today is a special ATP live. So, we only take questions that are related to the topic. So, apologies for that. Feel free to come back again next week. But today, please ask all your questions, because Dr. Buki may not come back. Dr. Buki will not be here next week. So, this is your opportunity. And she has our JE as well with her. So everything dental, everything oral health, please let's trash it today, because it may take us another few months before we have such opportunity. Okay, so the next question is, what about a child who is always who spits always? They said it's teething. Okay, so please, when you're asking question, always put the age of the children so that we have the context. So I have a feeling this say maybe a child less than a year. So who is spitting always? Is it teething? Or should we put it to say in another way that the sitting cause children to kind of bring out a lot of saliva or spit a lot?
Okay. All right. Thank you for that question. Like Dr. Gbemi has said, it's very important that we know the age of the child, because if the child is within the age of, teething, bringing out teeth, yes, because in teething, you will see drooling of saliva. The children, will be drooling saliva, bringing out a lot of saliva and all during teething. So depends on the age. But if you have a child who is like 6 years old, 7, and is spitting, then we have to see what could be irritated. Maybe there's an irritation somewhere that is allowing the child to be spitting. If there's an ulcer or something related. So you need to bring it out so that we can rule out any underlying dental issue. Otherwise, it may just be a habit that the child has developed over time. So we need to be sure that's of the age.
Okay, so Facebook user, if you are not satisfied with the answer because you didn't put the age, please feel free to ask again with the age, and I'm sure Dr. Buki can answer you. Okay, the next question is by another Facebook user. So these are people that are asking questions from our group, but they didn't put the permission for StreamYard to show their names. So if you want your name to show, you have to give permission so that Facebook can show your name. Okay, anyway, the person is saying, can we just use water and clean cloths to clean baby's mouth? That's what I've been using to clean my 2-month-old plus baby since birth. Please, I hope there won't be any problem for our teeth.
Not it yet. Yeah. Oh. So Jehi is going to answer that. Jehi?
Yeah, that's actually very good with cleaning your baby's 2-month-old mouth when even baby doesn't have teeth, and with the water. And actually, even later on, the cleaning with the cloth with little cool water is helpful for cleaning as well. It's actually very good. Yeah.
So thank you, Jehi. So that answers the question. Because your child does not have any tooth yet, so it's good to clean, because you're already inculcating a good oral habit for the child, so that when it's now time to be brushing, the child is not crying. A lot of mothers will say, oh, my child does not like brushing, they're always crying, because you didn't start to develop the habit for the child. So when you started, it's a good thing. 1 month, 2 months, the child knows it's time for me to open my mouth, and they know that it's time for cleaning. So it's like you're building that habit. And what you need to use at that time before any tooth is the clean cloth, as Jehi has told us.
Yes. Oh, lovely. We have a question from Instagram. Ms. Lovers is saying, how can you manage bruising? Bruising, for those who don't understand big grammar, is grinding of the teeth. When these children make this teeth grinding kind of noises. I hope I'm right, Dr. Buki.
Yes,
So,
you're right.
so how do you manage this in a 2-year-old? This is also a very popular question. Mothers always worried about their children grinding their teeth all night long sometimes. So what do you recommend from our dentists?
Okay, so grinding of teeth, like you said, we call it bruxism, and many reports have been said about what can cause it. Some is maybe the child is stressed. There's a change of environment. The child starts to grind the teeth. Maybe something you were not noticing before. Maybe there's a change of nanny. There's a change of school. Something that may be bringing some stress to that child. So you need to check that first and be sure that maybe there's what has changed that might be causing the bruxism. But usually for a child who is 2 years, we don't want to do anything yet. If it continues, and then we can give mouth guard, to prevent the teeth from wearing off. So we usually give that when in older children, they will wear it, and then it will prevent, even when they are grinding, it will prevent them from grinding down their teeth.
Okay.
So
Thank you, Dr. Buki. Just to mention that for some children, for us as pediatricians, we also worry about bruxism being a sign of subtle convulsion or seizures. So
okay.
see the dentist, but if it really goes on, especially if the child also has some other health issues, or even frank convulsion, please see the pediatricians as well, because sometimes some children children who have seizures can actually present that way as well. So we always
Wow,
want to
thank you.
yeah, we need to check.
Wow, that's great to know, doctor. From
Yes,
the pediatricians, you see, that
yes,
is coming from the side of the pediatrician. That's good to
yes.
know. Thank you.
All right, thank you, Dr. Buke. We still have a lot of questions here. Wait, I hope I didn't skip somebody's question. No, I didn't. Okay, Patricia is still here. She's asking, can you use mouthwash for a 4-year-old? And I think she's asking for a particular brand recommendation, which I know is not going to happen, but at least let's even answer the question whether children can use mouthwash or not.
So thank you for that question. Usually we don't recommend mouthwash for children below the age of 6 years. And even if you are going to give children that are 6 years, we want to give them the one that does not contain alcohol-free mouth wash. So you don't, because the reason is that they can't really spit out. At the time they are putting it down, they are taking some of it and they are swallowing it. So we don't recommend it for younger children. So just stick to the flossing, stick to brushing for them yourself at that age. You can allow them to practice, but you have to still brush for them, lift the lip, position the children right. Then once they grow up, then you can now give mouthwash from 6 years and above, 7 years and above even. Yes.
So sorry, this is even a question just as adults. When do dentists recommend mouthwash? Is this something we should be doing routinely as well, in addition to our brushing twice daily, flossing, and all that?
Yes, mouthwash is recommended. So if you brush your teeth, you use your mouthwash. But there are some mouthwashes that we will not recommend to be used on daily basis. The dentist has to prescribe that for you. And that you can use like 2 weeks because it can stain the teeth. So those ones we recommend, the dentist will recommend that one specifically for maybe a dental issue that is ongoing. But ideally, the ones you can buy off the rack, yes, you can use your mouth rinse. It's okay. Daily.
Oh, okay. Okay, so this is another question. Oh, sorry. That baby that we answered the question before was 11 months old. The one that spits a lot is 11 months old. So mom was asking them whether it's a sign of teething.
Yes, like we said, 11 months, yes, the child is still bringing out new teeth, okay? So it is possible that it's a sign of teething, drooling of saliva, it is. So most likely, but yeah, at that age, like I said.
Okay, thank you. The questions are coming out more and more now, so we need to, and our time is running quickly. Okay, the next question by Evelyn say, Doctor, my baby has just grown 2 teeth. Always put the age of your baby. Always, always. You don't know which baby. Everybody is a baby to the mother. Okay, so the baby has grown 2 teeth, so I guess it's still just a small baby, less than a year. Can I use the gauze and toothpaste? Aha, Dr. Buki, you need to address this question because a lot of Nigerian mothers growing up believe in using cotton wool or gauze rather than toothbrush because they felt the teeth are so tiny and they are worried that they are going to break it or destroy it with a toothbrush. So can you please, this is a very important question. I get it a lot, so I want you to address that as well.
Okay. Jehi
Yeah.
yeah.
So that's okay. Yeah, use the gauze and yeah, with a toothpaste, and then please just remove any excess fluoride. Yeah, toothpaste. But you can also use a little small, like a transitional toothbrush too, because baby's mouth is very small, and then teeth are small, and then mom needs the time to practice too, and then there's a transitional time for everyone, and baby needs some time to adjust too. So yeah, there's a transitional ones, the little ones
Yeah,
too.
can you show
So
that
yeah,
very
yeah,
well? I'm not sure they can see it. They brush your.
yeah, yeah.
Can you
She's
show it, Aya?
Oh, okay.
Can you lift it up, Aya? Yeah.
Traditional ones. Yeah.
Let me show.
Yeah.
Can you see it?
Yeah, I think we can see better now. Okay, good.
So your baby's teeth, this is sold in the market. When you go to where they are selling
Yeah, better,
babies
Dr. Bukola. Yeah, better now. We
stuff,
can see it now. Yeah.
you can ask them. They usually have it. So it's a finger brush. It's very soft, okay, and you can use it to brush your child's teeth. Yes. And then as the child grows older, we have very tiny brushes. This is another tiny one. If you go to the market, they have them. So it will not break your child's teeth, okay? And they are soft, okay? You start to introduce them to, toothbrush. So this is good. Please let us, because a lot of people say gauze and all that. Let's avoid gauze. We can get the age appropriate toothbrushes for them. And don't forget you use a smear. Not much. A size of, if you don't know what smear is, maybe a grain of rice. That size is just appropriate for your child. So we keep saying this often. So please
See
let's
the
use the appropriate
jinxing.
brush.
Yeah.
And we
Yeah.
continue to say it.
Yeah. We need to
Thank you,
say it
Jay.
over and over again.
No
Thank you,
problem.
Jai.
Because we don't want the baby to swallow the fluoride when baby's young, when they are developing teeth, because it may cause a stain later. It's internal stains. That's called fluororis. That's why we don't want the baby to swallow. That's why we want to use very little, very tiny. Yeah, that's what we need. Yeah.
Yeah,
Thank
Jay,
you.
while you are still there, somebody has actually is asking you from Instagram, like, what exactly is this fluoride and why is it important? Because you've been saying fluoride, fluoride. Wow, what is fluoride? Why is it important when it comes to oral hygiene and all that?
Okay, so fluoride is a component of the toothpaste that we always emphasize on. It's good because it protects, that's the simple way I can put it. It protects the teeth. It's reinforces the strength for the tooth so that the acid that is produced by the bacteria, it's not does not attack the tooth. So when you have fluoride strengthens the tooth. But we don't want that fluoride. The fluoride too, if it's too much, can also cause toxicity, can have side effects. That's why we say don't use too much. Use the appropriate size for children because you don't want them to swallow it, start vomiting, or start having stomach problem. And then when you have the excessive fluoride too, it can stain the teeth. So when they are bringing out their permanent teeth, you will see that the teeth now some look chalky. It will look extremely whiter than others. You will see some, that's what we call fluorosis. You don't want that as well. So fluoride should be used in moderation. It has its own good benefits, but at the same time, when it is too much, then it can cause a problem for the child. So what we say in dentistry is that it causes remineralization of a tooth that has been demineralized by acid. So the acid kind of attacks the tooth, the bacteria and acid attacks the tooth, but fluoride helps to, bring it back, strengthen the tooth and make it to fight against the acid and bacteria and germs.
Thank
Yeah,
you.
and
Thank
then, yeah, and also baby teeth enamel is very, very weak when it's erupted and then when it's developed. So that's why we want to protect the baby's enamel, the teeth enamel, with and then taking the benefit of the fluoride. But if you're really uncomfortable because of this all the side effects of fluoride, I know there's also toothpaste without fluoride is available for those who want to just practice. And then I know so many moms struggling with brushing the teeth. Their child, and then you can just make it as a more like a present play time, and then just to try to have a good habit, and then not so like something is not something that is all just get done or and forget about it. It's just more of I have a 3-year-old baby too, and then who is very bossy and who doesn't want to brush his teeth, but they just I spend so much time to just make it as a more play, and then yeah, and then there's things that you can use, but then please use the one with the fluoride though. But yeah, that's just for something that you can just try just for yeah
Okay.
play.
Thank
Yeah.
you.
Thank you, Jay. Thank you,
Make
Dr.
brushing
Bukola.
time a fun time for your children. Exactly. I agree
Yeah.
with you.
Exactly. Okay, Miss Loves was giving us an update on the child with bruxism, that the child has adenoids but not seizures. Okay, yeah, I'm still worried about your child. If a child has adenoids, because one of the challenges they have with adenoids is that there's what we call obstructive sleep apnea. So there's not enough oxygen getting to the brain. Sometimes the child can actually stop breathing and then they will continue again. So, and that what that means is that the brain sometimes is not getting enough oxygen. And sometimes we've noticed that some of those children can actually be having that subtle seizures, not the frank convulsion, but they will, that bruxism itself is a form of that subtle seizure. So anyway, the best thing is to get the adenoid sorted by the ENT doctors, and then you should see us if it persists. But you should see the dentist as well, so that they can give you like tips on the teeth wearing out and all that. So, but I worry because of those scenario around that baby. But that's just for you, not really. I think the child will benefit from getting support from the pediatrician as well. Okay, going back to the questions, I still have lots of them. Somebody say thank you so much for this opportunity. Temi Tokpa is saying, my question is, can a child of 6-year-old whose premolars was extracted grow back? Is the question clear? Like, if premolars was extracted, do you guys extract? I mean, for 6-year-old? Anyway, I don't know what happened, but can it grow back?
So the first thing is that a 6-year-old child cannot have premolar yet. Premolar is a permanent tooth. So maybe it was a primary molar
I
that
always
is
tell mothers
calling.
to avoid using medical jargons, just just tell us the teeth, where it is and what happened to it. Forget, let the
Yeah.
dentist worry about premolar and molar and all the other names that they have. Okay.
So all the baby teeth have successors
Mhm.
that will eventually erupt. Once it is a baby tooth and it was taken out, then it will come out. But you need to be sure that it was a baby. But at that age, definitely it must be a baby, not a premolar. So the only permanent teeth that would have come out maybe around that 6 years, maybe it is the first permanent molar, which is an adult tooth. If it is an adult tooth that was taken out, then it will not grow back. But I doubt if it is that tooth, because that tooth is just coming out. So I don't think it would have been taken out at that time. And I'm assuming that your child's tooth was taken out maybe because of tooth decay, extracted because of tooth decay. So I don't know the entire scenario.
Tell
But
me,
if
Chocolate,
it's a
can you
baby,
update?
Yes, she can update us. If it's a
Update
baby
the
tooth that was
question.
taken out,
Yeah.
then it
Okay.
will grow back if that tooth is actually present, because sometimes nature, the tooth may not even be there, but ideally, the permanent tooth should grow back.
Okay. While we're still on that question, I want to ask. I've seen some question about mothers worried that people think the incisors, those are the fronts, the middle
Yeah.
teeth should come out first. But I've seen a mother ask that is that lateral part of the teeth that came out first, and she was worried whether it's abnormal. There's something wrong with her child. So, is it possible for the first tooth to come out not to be the central incisors or the middle teeth? I mean, the front. I don't know how do you to call it for the mothers.
Yes. So are we talking
I don't want you
about
to call
the,
incisors. I don't want to confuse with medical
yeah.
jargons.
So when a baby is born, you're
Mm,
asking that which tooth comes out first,
mm,
right? When a baby is growing.
mm,
So we expect the first tooth when a baby is growing to be at 6 months.
mm,
Some children are before, and some children bring out their first tooth by 12 months. It's a
mm.
range. So we usually say between 6 months till like 12 years. If your child is not
12
bringing out the
months.
first tooth at 13 months, then we should be worried.
Okay.
Some mothers are worried even by 6 months, 7 months,
Yes.
their child
They
has not
ask
brought
all
out
the
the
time.
first tooth. Sometimes some children are slower. They can bring out their first tooth at 9 months even. Okay. Then it's usually the lower teeth that can, but even if the upper ones come out, it's not a problem. Okay. So ideally, according to textbooks, it's just that the lower teeth, will come out first. But sometimes you can have the upper ones coming out first. So the most important thing is that at the end of the day, you have the 20 primary teeth, okay, intact, and then you are brushing them and you are looking after the teeth. If you are seeing anything and you are still worried, please see your dentist. Okay.
So what about the
There's no
lateral?
need.
Can the lateral come out first? Can
And when you
the
say the lateral, because you are pointing your hand to the back.
No,
That's
I'm
not
trying
the
to avoid.
lateral.
I'm trying to avoid using big jargons, but like the molar teeth, can the molar come out before the incisors?
Sometimes you can have that, is rare, but usually you have the incisors usually come out before the molars.
Okay, good.
Yes.
I just want mothers to know that they don't need to worry anyway about those kind of
They
things.
don't need to worry, exactly. They don't need
You
to
know, we
worry.
are
I
very
think there are some
fastidious in
myths that
Nigeria.
are tied. Some myths are tied to Eleyi Oke, Eleyi Isale. Please,
Uh-huh.
let's not worry about it.
Yeah.
Sometimes the children will just decide the tooth they want to bring out first. So, but I don't think that should be any problem unless you are attaching a myth to it. But for
I guess.
dentists, we are not worried.
Okay.
Yeah.
I just want them to hear from the dentist that they should not worry. And if the teeth doesn't come out before 1 year, don't worry as well. But you can go see the dentist at 1 year anyway. Okay, somebody said, please, do we start cleaning the mouth with clean clothes once the child is born? And should it be every day?
So we usually say, of course, the first day you may not want to bother about, but what we say is that few days after birth. So you should start cleaning the mouth with the cloth and water, because by that time the child is already being breastfed, bottle fed, as the case may be, and you don't want the milk to remain in the mouth. So you just wipe simply every day. You just wipe it with water, and that's okay. You don't need anything more than that. Just a clean cloth, damp in water, and then use it to wipe every day for the child.
Okay, thank you. Our time is gone. We're actually supposed to be running off now, but we'll quickly clear all the questions that are left and then we'll round up for today. I don't think I'm going to talk about Down syndrome today. I'll talk about it another day, maybe next week. Don't worry. I've talked about it several times before, but we'll talk about it again. So Atai Josephine is asking, It's a long story, but the basic line is our baby is 6 months old and baby cries at the sight of complementary food. The baby is biting, showing on her hands and her body, biting the nipple when sucking, sleeping short sleep. Could it be teething? Could it be teething? That's the question.
Exactly, because that is the age. Thank you for telling us the age because it's very important.
Very
Six
important.
months, yes. Does your child have any tooth yet? If not, it's a sign of teething, of course. When a child starts to bite, want to, nib on things, because there's irritation and anything they find, they just want to use it to, scratch the gums. So, yes, most likely. And if you feel it, you may even be able to feel, the bulge of the teeth. You can use your clean hand to feel it. You will see that the teeth are about, to come out at that time. So you said about complementary food. The child is not taking the complementary food. Maybe Dr. Gbemi can, guide with that because
And
that's a good time to introduce complementary food for
yeah, I
your
just want,
baby.
I think mothers should just be aware that teething is just, the teething thing happens over like a few days or weeks. Dr. Buki, is that not so? So it's not something that's going to go on forever. So just hang in there and all those symptoms will still resolve. Once the teeth are out, then the teething symptoms will all go away, right?
Yes,
But
yes.
most Nigerians mother asks you this question about, is it teething because of one thing? And I want Dr. Buki to answer that. It's because they felt that, oh, is it teething so that I can go and buy teething powder and I can go
Ah,
and buy teething mixture? Yes, I know that is where we are going because they want to go and buy it. So please, dentist, dental promoter, tell us, should we be using it or not? So that I want you to address them. Because when they ask you, is it teething? So then the next thing is, let me go grab my teething drugs.
Do we have a teething powder?
so yes, thank you. We forgot to mention that. Thank you, Dr. Gbemi.
I know my people.
Thinning powder is a no, no, no. Please do not use anything. We recommend, and your dentist or pediatrician, we recommend that if the child is having some increase in temperature, just give some paracetamol. Okay? No teething powder. We don't recommend any teething powder or anything for your baby. Please note it. There are many names in the markets. I
I
don't know.
know,
Dr.
I
Gbemi,
know,
will know them.
I know that is actually the issue because mothers go to the shops and they see products being marketed as teaching mixture, teaching this, teaching that. And I always try to tell people always ask me that if there is no need for them to use teaching mixture, teaching powder, why are they being produced? Why are they being sold? I throw that challenge to the manufacturers, to the pharmacists. Why do we have these products in the market? And what do they normally put in those products anyway? Paracetamol and chlorpheniramine. That is what is inside. So they put these something for pain and something for to make the children sleep, really. But we don't recommend that. The dentists
We
don't
don't.
recommend it. Pediatricians don't recommend it. So
We
the fact
don't.
that the people are selling it does not mean you have to use it. The only
Exactly.
the only thing that makes a product gets recommended or sold in the market is that it's not going to cause. It's a safe drug. So obviously, paracetamol is a safe drug. Chlorpheniramine is a safe drug. But is it safe for a child? That's the question here now. So giving your child a drug to make them sleep and all that is not good. So we don't recommend it. And in Nigeria, we do get adulterated form of these products.
Exactly.
There's a case in mine is in my Peking saga.
Yeah, I was going to say that.
Yeah, I
Yeah.
was right in the thick of my Peking where a lot of children, elderly children who has no problem with them, came down with renal failure. We lost some of them. Many of them end up in their lives, all because they were given teaching mixture that has been adulterated with methanol or ethanol, one of them, methanol. So, and all these children don't even need these drugs. The only reason why they even end up taking this so-called my Pekin medication was because their mothers want to give them teething medication, which is not even necessary. So if your child has fever, give paracetamol. If the fever is not going down, it is not teething.
It's not.
Please go to the hospital. Don't. And why we
Okay.
also don't even like teaching mixture is that mothers always make diagnosis of teething for everything. Child is coughing, child has diarrhea, child that is not eating, everything
It's
is
teething. Teething is in trouble.
teething. And then when they once they make that diagnosis of teething, then they start teething powder because that is the solution. So if I've made a diagnosis of teething, then the treatment is teething
It's
mixture.
teething powder.
And Dr. Bukola, some of them start this teething powder or drug from day one, newborn. And I always tell mother, there's no drug that is safe. Every drug is a poison. Even your paracetamol. If you give them paracetamol every day for 6 months or 1 year, the child is going to have liver failure. That is the truth. So
Exactly.
don't give it. So if your child has any symptom, you give paracetamol with day 1, day 2. It doesn't go. You need to take your bag and get yourself to the hospital. Please, our drug companies, let's stop producing this so-called teething mixture. We are causing a lot of problems for our parents. We don't want it. We don't prescribe it. The dentists don't recommend it. So who are the people producing them and putting them in the market? The dentists have told you what to do. Use the teething, what they call rings and all that. And it's something that happened over a few days and it's all over. So let's not cause harm. A lot of children end up with renal failure because of teething mixture that is not necessary in the first instance. So this is an opportunity for us to remind ourselves of that thing. So thank you so much.
Thank you, Dr. Gbemi. That is so, in fact, let the teething process is a natural process. Let it take its course. And if there's any, let it take its natural course rather than giving medication. Some people don't know when to stop it. Some people, like Dr. Gbemi said, you just continue to use it. And some of them, they contain other things. So please, let us stick to what the experts have said. Both in Nigeria and all over the world, we don't believe in teething powder.
Okay.
Pediatric dentists, not just in Nigeria.
So it's not a Nigerian thing.
The expert body, the authorities on baby teeth says no
teething powder, no teething mixture. Okay, let's quickly finish. Our next question, it's my son's teeth, the 2 incisors were stained. How do I remove the stain? The child is 2 years old. We didn't talk about teeth staining today.
Yeah, we didn't talk about staining. So when you talk about stain, there are different kinds of stain. So it's good to see the baby. There's what we call intrinsic stain and extrinsic stain. Intrinsic is that it's within the tooth itself, the tooth tissue. So it cannot be removed by mechanical means or chemical means. It's just within the tooth. But if it is extrinsic stain, maybe it was caused by a medication. Sometimes some medications that they take can stain the teeth. Some even poor oral hygiene, not brushing for your child, can cause some yellowish stains. Some beverages that we give our children can stain the teeth. So we need to know which one. But if it is extrinsic stain, that can be removed by the dentist, You can remove it. Even intrinsic stain, so depending on the level. So it's good that you take your child to see the dentist. Let us know the cause of the stain, whether it is even tooth decay. Sometimes you may just think it is a stain. It may just be that the tooth is becoming brownish as a result of tooth decay that is starting. So we need to know what is causing that stain. Okay. So it's important to take your child to the dentist. If you have brushed and it's not going, that means something you cannot take out by yourself. You need the assistance and help of the professional to look into it and see the cause of the stain.
Thank you, Dr. Buki. We are rushing now. Idowu is saying, my baby is 10 months old and no teeth. Should I be worried?
So your baby is 10 months. Let's give your baby till you can. In fact, you should take your baby to the dentist now. Okay, that's what we say. We say take your baby to the dentist on or before the 1st year. Okay, so let's let the dentist see it. We can feel for it and see that, the teeth are there and they're about to come out. So don't worry, but this is a good time for you to visit your dentist. Okay, ideally we say 6 months to 1 year for the first tooth to erupt. So your child is 10 months. We even want to know whether those teeth are present or not. So go to the dentist. there's a way we can look at it. We can take X-ray and see that those teeth are actually there. They're just taking their time
To
to
come
come
out.
out. So
Okay.
go to your dentist today, pediatric dentist, and then we can
Okay.
reassure you. Okay.
Thank you. Rosemary is saying that the just okay. A baby is 17 months old. He's always opening his mouth and drooling. How can I make him close his mouth? I'm not sure whether this is a dental question or not, but I will let the dentist take a shot at it.
So my baby is having a fever, but it has stopped now. So
Yeah.
before the fever, was he always opening his mouth? That's one thing. But from what I see, you said he's 17 months old and he's always opening his mouth and drools too.
Mm,
So yeah, drooling, like we said, could be part of teething. And then that always opening the mouth too, we may need to check more so that we can see that there's no, sometimes a child may be a mouth breather,
mm,
and the child is always breathing through the mouth instead of through the nose. So we need to be sure why the mouth is always open.
mm.
But the child can always close the mouth later. We worry a lot about things, but if we're able to rule out some other underlying things,
Yeah, it could actually be a dental, it could be medical issue as well.
yeah,
So, because your baby
yeah,
is also snoring, and I guess that what Dr. Buki is saying, that this child is a mouth breather. Because if a child has like adenoids that is blocking the nose,
adenoids,
they
yes,
are opening their mouth because that's the only way they can breathe. And
they can
so
breathe,
you need
yeah.
to. Anyway, I guess you've seen a doctor because your baby was sick, having fever and all that. But yeah, so just ask your doctor more questions.
Oh, and I like that she said they are quadruplets. Congratulations, you have 4 at once.
Yeah,
Amazing.
she's one of our.
Do they all open their
Yeah,
mouth,
no,
or is
it's
it just one
only
of
I
them?
think
This
it's
is so
only one
interesting.
brother. Yeah. Okay. I think is it two of them? Maybe two of them opening their mouth. Yeah. Okay. All right. Rosemary, see your doctor. Yeah, you can come back. Ask us later. Somebody say my baby 1 year bites my hand when I brush him, and he cries a lot when brushing. I try to brush as gently as I can. What can I do? Yeah, most parents actually struggling with brushing toddlers.
I know. I know it can be very difficult, but you can make it fun. We have some, you can make it music time as you're brushing for them, you're playing music. We have interesting toothbrushes that can sing. If you can get, it's not compulsory, please. And also there are some, you can
Uh-uh.
have, yeah, Jehi, thank you. You can have all sorts of things to show that brushing can be fun time.
With
So
Bunny.
we
Oh,
can
is it
make
which
it
one is this
fun
one?
time, but you must brush it. You have to, so that they don't develop problems in future. So make
Okay.
it fun time, singing along, and then brushing for them. All
Okay.
right.
Next
Thank you,
question.
Jenny.
Okay. Oh, sorry. Temi Tokpa is giving us updates. That was the person asking about the 6-year-old that the premolar. I think she meant primary molar, and it was extracted because of tooth decay.
Yeah. Okay. So yes, if it's the primary molar, it will grow back if it is present in the mouth. Usually it's present, but in rare cases, it may have congenital absence of a tooth, but it's rare.
It's rare.
But it
Anyway,
will
the
come
dentist
out.
can
So
always
don't
fix.
worry,
They can
mommy.
fix everything. They can give you a new teeth as well. Okay, Ikiri is saying my 4-year-old have a broken teeth, like broken teeth, like 6 broken teeth, I guess. Will they grow a better one? It's a 4-year-old. Okay, I'll leave that to the dentist.
I'm worried about the broken
Me too.
because to me it's more looking like maybe a defect in the teeth, more like it fell down. When you say broken,
Or it could be
I'm
teeth
thinking
decay as well. Sometimes my parents use those words,
yes,
not
they mix
necessarily
the
like
words
break.
together.
Mm,
So maybe a tooth that is being the teeth are being decayed and they are breaking down due to
yeah.
decay.
Mm,
So the first thing is to take your child to the dentist. Those teeth can still be salvage, if I can say that, maybe filled or managed or treated so that they will stop breaking down. Okay, so there's some if you take to the dentist, we can fill it up, give you
mm,
fluoride, and then stop that breaking down. Okay, so I need to know what break is. That means the teeth are still there or something is attacking it and is causing it to break down. So please see the dentist so that it does not progress. It stops and it is filled and does not affect the other teeth that are going to come erupt.
Okay, somebody told me it's the Ninja Turtles. The thing is Ninja Turtles. Sorry, I'm so I'm so old school. I don't remember the names anymore.
What's the ninja? Say that again.
Is what you're showing us the?
Oh, it's a dinosaur.
Is it a dinosaur? Okay. It's always go with us to our all our outreaches. I remember Dr. Buki is always going with them.
Yeah.
Okay, now we've answered this one. Okay, Dr. Rotimi is saying thank you, Dr. Buki, and our special guest, Jay. Thank you. Thank you. Lovely. Thank you. Everybody seems to be enjoying the session, and nobody seems to be going away despite the time. Thank you, Dr. Buki.
Thank you all.
Thank you. Everybody is happy. Yeah, okay. Rosemary is giving a comment that mothers will not agree with me that eating is not an ailment. Okay, but she's giving a testimony that she have nursed 9 babies without eating drugs.
Wow.
Good.
9 babies.
She's the mother of the quadruplets. So you are a superstar. You're a super mom. 9 babies. Oh my. Well done. Well done. Thank you. Okay, so everybody's saying thank you to you. Okay, this question is about intake of cefuroxime prevents him from feeding well. The child has cough and cut. Anyway, if a child is sick, they will have poor appetite. This is not relatable because let me just answer it quickly. If a child has if a child is sick, they may have poor appetite. So it's not the medication can give side effects of poor appetite, but the child can also have poor appetite from the illness. So, but just continue the medication as they get better. They will get. Okay, so Rosemary is saying we know there are 2 different babies. Your question, we've answered them. So those are the babies that were opening their mouth and snoring and drooling and all that. The quadruplets. All right, thank you.
One more thing we didn't mention: pregnant women, pregnant mothers, please do not self-medicate. When you're taking some medication during pregnancy, it can affect your child's teeth. So tetracycline is a no. It can cause browning of the teeth. And not only when you're pregnant, when you have had your child, do not give tetracycline to a child that is below 12 years old.
Exactly.
Those teeth, the permanent teeth that will grow will just be brown and they will be stained. You wouldn't like the color of the teeth. So tetracycline stain is a big issue. Please do not take tetracycline. And even any medication that you are not sure of, make sure that you don't self-prescribe. See your what do you call it now? Your O&G doctor and
gynecologist obstetrician. Yeah.
Someone asked about when should I start brushing. We've talked a lot about that. Brushing as soon as the first tooth comes up. Cleaning the mouth. Few days after birth, you clean the mouth. You can go back and watch the video. I just saw the question here and I thought I should answer.
Yeah. The final question is from Instagram. Say my 5-year-old 2 front teeth have been there for over 6 months. Should I be worried? I'm not even sure I get this question. My 5-year-old has 2 front teeth, growing lower teeth, been there for over 6 months. Should I be worried? I'm not sure. Your question is not clear, Lola. Dr. Buki, do you make sense of that question?
12-month-old.
No, a 5-year-old has 2 front teeth.
Okay, I can get the question. Yeah.
And they've been growing there for over 6 months. Should they not be growing? Are they not supposed to be, is it the permanent teeth?
I feel maybe one of the issues we usually have, complaints that mothers have is, for that 5-year-old, what I'm trying to picture and what is common is that the baby teeth is there and the permanent is also growing at the back.
I guess so.
That is what she's trying to, and it usually happens in the lower jaw.
Yeah.
You have 2 sets. The baby teeth have not fallen off and the permanent one is still there as well. So usually if the baby teeth are shaking, just give your child an apple to eat. they will fall off. Let
never
the
heard
child
that.
eat an apple. If it's not going off, take the child to the dentist, then it can be taken off so that the back teeth, the permanent teeth, can now take their position. But usually I don't want children to experience taking out of their teeth, as their first experience at the dentist. If you can give them an apple to eat, and especially if the teeth are shaking, it will just go off naturally, to fall off by itself. But if it's not, the teeth are not shaking, they are not mobile, and they are there, you need to take the child to the dentist, okay? And then the appropriate treatments will be given to you. All right.
All
That's
right.
the question, because I feel that is what she's trying to ask.
I also suspect so, though the question was not clear enough. But you see, the pediatric dentists, they always know the questions mothers want to ask, even when you're not saying it the right way. Okay, so we've come to the end of the program. We've done a little bit above our normal
Jay,
time.
you wanted to show us something. What do you want to show us?
Okay, Jay, yes, please show us.
I mentioned the cheese is actually a very good snack for your teeth. It can alter cavity-causing bacteria. So I would like to mention this. Cheese is very good for your teeth. Yeah.
So Jay is showing us cheese.
Yeah.
So if you can afford to buy cheese, cheese is good, okay?
Not cheese balls.
Not cheese balls.
I like the Nigerian mothers to know the difference between cheese and cheese balls.
Not cheese balls, please. Cheese balls is a no, it's very sticky. So there's what we call cheese balls. That's a snack.
It's like
that's
a
very
snack.
sticky
Corn,
and it's dangerous.
Or
But the normal, natural cheese,
cheese,
okay?
And please also lift the lip and check this area. This front teeth are very prone to cavities. So we recommend just once a month lift the lip. But as much as you can, just keep checking your baby's front teeth.
Exactly.
Yeah.
Okay, so what Jehi is saying is that mothers, don't forget when you're brushing to lift the lip, okay? Because the upper teeth are where you usually have the decay, okay? And it's always covered. So when mothers are brushing, they may forget. So lift the lip, okay, and always check around, okay? To be sure that there's no tooth decay. All right. Okay, that's very fun. Thank you, Jay.
Thank you so much, Jay. I mean, we are so privileged, so honored to have these experts talking to us today. Initially, I thought I'm going to have Dr. Bukola alone, but now she brought another international expert to talk to us about how to promote our oral hygiene. So my job is just to say thank you to our guests. Let me start by thanking Jay for your time. I know it's not easy giving us over 2 hours of your time, because they've been with me in the studio even before the program itself started. So I mean, I really just want to say, on behalf of all our children in Nigeria and all over the world, thank you so much for being here today, and thank you so much for your contribution. We really, really
appreciate thank you, Dr. Gbemi.
And of course,
thank you for inviting us. We are always happy to be, and we are part of of course, I'm a part of Ask the Pediatricians. I like to say,
she didn't even allow me to thank her.
To who? Share to Jay.
Because she's family. No, you.
Yeah,
you
so
allow me to say your don't thank you. Go ahead.
Thank you to Happy Smile, Happy Child, Dr. Robert Schroth Lab, for providing all the materials that we use today. That's where we are projecting this from. So Happy Smile, Happy Child. Yeah, they provided all the materials that we use today. So I acknowledge my big boss, Dr. Robert Schroth. And
Thank you, Dr. Robert. Thank you, Dr. Robert. Thank you, Dr. Bukola. Thank you, Jay. If you are late to the program, no worries. I tell you, you need to watch it again. The video will be there on YouTube, on Facebook, on Instagram, on my podcast, Ask Dr Gbemi ATP. I'm recording it already for the podcast. So please take your time to go back, listen again, and make sure you implement all these strategies. And the dentist wants to see your child from on or before the age of 1 year and every 6 months. I know it's not our culture in Nigeria to go to the dentist, but I think we can start with our children's generation to always take them to the dentist every 6 months. Thank you. Dr. Bukola, I'm helping you to promote the pediatric dentistry ministry in Nigeria now. So thank you so much, everybody, for my friends on Instagram, on Facebook, on YouTube. Thank you, everyone. I will come back next week by God's grace. Hopefully, another time I'll bring another guest. Sorry, I can't talk about Down syndrome today, but because I don't tend to have special guests often with me, so I really want to maximize my guests being here today, answering all the questions. So we will definitely talk about Down syndrome maybe next week. Thank you so much. And so from us, it is goodbye and have a wonderful evening. Bye, bye, dinosaur. Bye. So the broadcast is ending now. Bye.